When completing a female breast exam, I would start by instructing the patient on what we were going to be doing and walking them through each piece of the exam. I would start by just assessing the breast, looking at the symmetry, looking at the skin, looking for any pewter orange, any masses or any dimpling or tucking of the breasts, then looking at the nipples, looking for any inversion. I would then ask the patient to lift their arms up over their head, looking at the movement of the breast, looking for any immovability or tucking of the breasts. Then I would have them place their arms on their hips and contract their muscles, again looking for any difference in movement or immovability of the breast, any tucking or dimpling of the breast tissue. I would then have the patient move forward, lean forward, and again looking at the movement of the breast, any immovability or tucking of the breasts. And then if the patient has large or pendular breasts, I could compress the breast between my hands and roll forward, feeling for any masses or any lumps, any tenderness or any pain. At this point, I would have the patient relax back and relax their arms and continue on with the lymph node assessment, letting them know I'm going to be placing my hand in their axilla or in their armpit, and it may feel slightly uncomfortable. Placing my hands up deep in their axilla, feeling for their central axillary nodes. If I felt anything greater than a centimeter, anything hard or stony, anything tender or warm, I could assess their pectoral lymph nodes in the front of their axilla using my thumb and my forefingers. Assess the post-axillary or the subscapular nodes along the back of their scapula, as well as their lateral nodes along their humerus. Also feeling for their infraclavicular and their supraclavicular nodes and assessing both sides. After I've assessed the lymph nodes, I'll move on to assessing the breast tissue. So I'll have the patient lie supine with a pillow behind their right shoulder and moving on to their left hip, placing their arm over the top of their head. I'll start at the tail of the breast tissue, starting up at the clavicle and the inside of the axilla, and then moving in a light, then medium, and then deep circular motion. I'll move down the breast tissue in a vertical stripe pattern, not lifting my touch, and assess the breast tissue until I reach the midclavicular or the nipple line. At that point, I'd have the patient move their hips back supine or back flat on the table and have them place their arm back down to their shoulder or near their ear to displace the breast tissue back over so that I can assess the medial breast tissue as back over down towards the sternal border. And then I would repeat this process on the other side, so placing a pillow over the under the left shoulder and then have them scoot onto their right hip, having them place that hand over their head. And again, beginning at the clavicle and the axillary at the breast tail, and moving with a light, medium, and then deep circular motion in a vertical stripe until I reach the midclavicular or the nipple line, and then having them move back supine and assessing the rest of the breast tissue until I reach the sternal border. These are all similar techniques to assessing the male breast as well, assessing the nipple, assessing the axilla, and then assessing the breast tissue as well.